Trauma is extremely common among young people with Fetal Alcohol Spectrum Disorder, or FASD. Between 58% and 95% of young people with FASD have experienced some form of traumatic event. Young people with FASD experience on average 3.4 times more traumatic events than their peers. Trauma is an emotional response to distressing events or circumstances that can cause lasting psychological harm. This harm can disrupt everyday functioning and affect emotional well-being. Trauma can stem from a range of experiences, both recent and in the past. Trauma can also be intergenerational, with its effects being passed on from one generation to the next through a combination of behavioural, genetic, and environmental factors. Young people with FASD are more likely to be raised outside their biological families, experience caregiver disruptions, and be exposed to substance use, neglect, and violence in their household, all factors which increase the likelihood of trauma. Additionally, people living with FASD can experience trauma from the stigma and labelling that may be associated with their disability. Dysmaturity and difficulties with executive functioning, memory, impulsivity, and sensory processing increase the stigma. The effects of trauma look different in everyone. However, common symptoms include difficulties with attention, interpersonal relationships, self-esteem, cognitive functioning, memory, emotional regulation, anxiety, and depression. Understanding trauma is important for educators, as many of these challenges may overlap and intensify the difficulties associated with FASD. In the school environment, trauma can increase the existing challenges faced by young people with FASD. A young person with FASD who has experienced trauma may have even more difficulty focusing, following instructions, or engaging with peers and teaching and support staff. They may also be prone to disruptive behaviour, emotional outbursts, or withdrawing from others. These challenges can make it harder for them to succeed academically and socially, placing them at risk for further isolation, school avoidance, and mental health issues. The ongoing cognitive and behavioural impairments caused by FASD may also leave young people more vulnerable to experiencing traumatic events, including physical or sexual abuse, mental health issues, and contact with the justice system. As children with FASD and trauma grow into adolescence, the effects of both may compound, intensifying cognitive and behavioural impairments and making it more difficult to engage in social, academic, and personal settings. That's why understanding and supporting young people with FASD in the school setting is so important. While trauma can only be diagnosed and treated by clinical professionals, educators can help a young person feel safe by fostering a stable, consistent, and supportive school environment by being aware of the signs of trauma, using a trauma-informed teaching framework combined with a thorough understanding of FASD. This involves adopting a strengths-based approach to understanding FASD and trauma's impact on learning, and adapting teaching practices to support a student's sense of engagement, belonging, and self-esteem. Referring a young person to the appropriate services, such as school counsellors or trauma specialists. Educators can also visit Learning with FASD, a website that houses evidence-based resources such as fact sheets, guides, and videos, designed to help Australian educators understand and support young people with FASD.